Leukemia is a type of cancer that starts in the bone marrow, leading to the production of abnormal white blood cells that can crowd out healthy cells and impede the body's ability to fight infection. Common symptoms include fatigue, frequent infections, and easy bruising or bleeding due to the reduced number of healthy blood cells. Some patients may also experience bone pain, swollen lymph nodes, and unintentional weight loss as the disease progresses. Treatment options vary depending on the type of leukemia and can range from chemotherapy and radiation therapy to targeted drug therapies and stem cell transplantation. Risk factors for developing leukemia include genetic predispositions, exposure to certain chemicals like benzene, and previous chemotherapy or radiation treatments. Here's a detailed look at various aspects of the disease, providing a deeper understanding of its complexities and challenges. Symptoms and progression of leukemia. Leukemia, a type of blood cancer, often progresses stealthily. Its symptoms can be subtle and nonspecific initially. Patients may experience fatigue, fever, unexplained weight loss, and night sweats. As the disease evolves, symptoms become more pronounced due to the accumulation of dysfunctional white blood cells. This leads to frequent infections, pronounced bruising or bleeding from minimal trauma, and petechiae, which are tiny red spots under the skin caused by minor hemorrhages. Lymph nodes may swell, and individuals could notice discomfort or fullness in the abdomen as the spleen or liver enlarges. These manifestations occur as leukemia cells overcrowd normal blood cells, disrupting the body's ability to carry oxygen, fight infections, and control bleeding. The rate of progression varies. For instance, chronic leukemias can smolder for years without symptoms, whereas acute forms can escalate within days to weeks, necessitating prompt medical intervention. Diagnosis of leukemia. The diagnosis of leukemia, a type of blood cancer, hinges on detecting abnormal increases in white blood cells, or blasts, in the bone marrow or peripheral blood. Techniques such as complete blood count, CBC, and peripheral blood smear provide initial clues. Definitive diagnosis, however, requires more intricate procedures like bone marrow biopsy, where a sample is examined under a microscope or through flow cytometry to identify leukemia cells based on their distinct markers. Molecular genetic tests, such as PCR, fish for specific gene rearrangements that are characteristic of different leukemia types, aiding in tailoring treatment strategies. Early and accurate diagnosis is pivotal for improving prognosis and survival rates. Cause and risk factor of leukemia. Leukemia, a type of cancer that affects blood cells, particularly white blood cells, WBCs, arises due to mutations in the DNA of developing blood cells. These mutations trigger the cells to grow and divide uncontrollably, leading to an accumulation of abnormal WBCs, which do not function properly and can crowd out healthy cells. While the exact cause is often unknown, risk factors include genetic predispositions, exposure to certain chemicals like benzene, previous chemotherapy or radiation therapy, smoking, and some genetic disorders like Down syndrome. Understanding these risk factors helps in identifying populations at higher risk and guides strategies for prevention and early detection. Treatment and management of leukemia. Leukemia treatment and management are multifaceted and highly individualized, relying on the specific type and phase of leukemia, as well as the patient's health status and age. Chemotherapy remains the cornerstone, often in conjunction with targeted therapies that precisely attack cancer cells while minimizing damage to normal cells. Stem cell transplantation offers potential cures for some types, especially acute leukemias, replacing diseased bone marrow with healthy cells. Advances in immunotherapy, such as CAR T-cell therapy, have opened new avenues for treatment-resistant leukemia, harnessing the patient's immune system to combat the disease. Ongoing clinical trials continue to refine these approaches, striving to increase remission rates and enhance the quality of life for leukemia patients.